Good evening and welcome to Mary Washington Healthcare's monthly Career Conversation Facebook Live event. My name is Darla Burton and I'm the Director of Associate and Physician Recruitment. We are so glad to have you join us this evening. We are here tonight with Deborah Marineri and Tanya Thigpen. Both represent nursing leadership and look forward to addressing any questions you may want to ask during this recruitment conversation. We will be discussing nursing practice at Mary Washington Healthcare. Deborah is the Administrative Director of Nursing Operations and Practice at Stafford Hospital. She has served in many roles, both clinically and in administration, over her 27-year career with Mary Washington Healthcare. As a board-certified nurse executive through the ANCC, she's an advocate for all nurses to drive excellence in care of our patients and in each RN associate's nursing practice. She's a native of the Fredericksburg area and is proud to be able to provide care to the community for which she was born and raised. Tanya is the Director of Critical Care Services and Interim Director for Emergency Services at Mary Washington Hospital. Tanya has been in nursing for 26 years and is certified as a critical care registered nurse, critical care clinical nurse specialist, and an advanced nurse executive. Tanya is high energy and loves a good adventure. Please join the conversation by submitting your questions during the event. We will try to answer as many questions as possible during the event. However, if your question isn't addressed, someone from the recruitment team will follow up tomorrow. Welcome, ladies.
Thank you, Darla. Thank you, Darla, so much for the great introduction. And Tanya and I are really excited to be joining you guys tonight, and thank you all for joining us. We're excited to be talking about nursing practice here at Mary Washington Healthcare. And I know we have about 30 minutes to talk about nursing practice, but I believe Tanya and I could talk for hours. So we are going to start off with some general information about nursing at both facilities, both Mary Washington and Stafford. But please do not hesitate to reach out to us with their topics. So we're happy to entertain any topics that you guys would like for us to talk about tonight. Stafford Hospital is our newest hospital, and that's in Stafford County. We were built in 2009. We're a full-service community hospital. It was intentionally built in Stafford due to the growth that we were experiencing here in the community. And it's neat to be able to offer more services to a growing community. When we built Stafford in 2009, we purposely did not recreate everything that we had here at Mary Washington, and Tanya is going to get into more of the services related to Mary Washington Hospital. But at Stafford, we're able to have a 15-bed emergency department that sees on an average between 90 and 100 patients daily. We have a medical unit, a surgical unit, cardiac unit, an ICU. We have a beautiful 15-bed labor and delivery suite, postpartum unit. And we're delivering about an average about maybe between babies a day at Stafford, anywhere between up to a 15-bed census daily, and that continues to grow, and we're already looking about expanding there as well. But I'm going to go ahead and turn it over to Tanya, who's going to talk more about Mary Washington and the services that are offered, especially here.
Yes. So thank you, Darla, for the wonderful introduction. And just what Deb said, over at Mary Washington Hospital, we are a larger hospital, 400-plus bed hospital, which we are also a level 2 trauma center. So we have an emergency department that is a 50-bed unit, and we see an average of 160 to 200 plus patients a month. So very, very busy, and we love our trauma over here at Mary Washington Hospital. We also have unique specialties as well at Mary Washington Hospital, critical care services, cardiac services. So we do open heart surgery here at Mary Washington Hospital. We also have a surgical care center where those nurses are dedicated to taking care of different types of surgical patients. Medical care center where a med-surg nurse can be the super expert. We also have women's and children, labor and delivery. We have a NICU for those who are interested in taking care of the really small babies, and a pediatric unit. And we have just a plethora of specialties for any nurse who wants to come to Mary Washington Hospital.
And I think, Tanya, you really hit on a really good point for our organization, especially Mary Washington Healthcare in general, for both hospitals. We truly were committed to providing the care here in our community, which is part of our mission. And so therefore it's just amazing to hear all the services that we offer even at both hospitals. That really helps us to keep patients and their families here and not having to worry about to go outside of their community to search for care and get that care when they can get the best care possible here right in our community. So it just really is neat to hear that list of what we are able to offer. And that also opens up a lot of nursing opportunities for us as well, which is very exciting for anybody who is new to nursing or getting into nursing. There's lots of opportunities right here in the community.
Yes. And one of the core individuals I like to point out is we have clinical nurse specialists here at Mary Washington Hospital. So the clinical nurse specialist is the nurse's nurse, the physician nurse, and the system nurse, and really does have a great perspective on how to develop our new nurses and actually how to develop an organization. We also have educators who are embedded within units who are the touch point for our new associates to make sure that we're onboarding them correctly and they're getting the education to properly take care of the patient with our focus on evidence-based practice, because that's what we do here, and also to align with our nursing strategic initiatives.
Yeah, Tanya, you just brought up a good point too, because we know as nurses we are onboarding, we just know how important orientation is, and the success of that nurse and everybody that works at Mary Washington Healthcare is how they are greeted, and that welcome that they get when they first come here. So that's why we're very lucky to have such high caliber nurses such as the clin specs and the educators there to support nurses in all the different areas. So we're very fortunate in all regards. Absolutely.
And one of the other things that I like to bring up, although we're two different hospitals, we try to represent the same thing. So what a nurse gets at Mary Washington Hospital will get the same type of education at Stafford Hospital, and making sure that we are standardizing the process. And my favorite word is to have a more systemness approach to how we educate our nurses. So if a nurse is interested in going to Stafford Hospital, then it's an easy transition to go to Stafford Hospital, and there is no variation in practice.
Yeah, absolutely, and vice versa too. We have nurses from Stafford that like to go over to Mary Washington, and it's just a nice working environment that way in partnership. So again, we're very fortunate to have some collaboration between facilities. So Tanya, what about we just talked about nursing and bringing onboarding, and I just wanted to point out that we are in the midst of new grad season. In fact, for those that are interested or in school now and will be graduating in December, we are taking applications for our next group that we'll be hiring, and that we start interviewing around March time for actually to get them here in the door and ready to go. So these are for anybody that's graduating in December. And I don't know, Tanya, if you want to talk a little bit about the program itself and why we're so lucky to have such an opportunity to have a new grad resident program.
Right. So the new grad program, what a super fantastic program. I wish this was around 26 years ago when I was into nursing, but this program is very unique to the Mary Washington Healthcare because it crosses over to Stafford as well. It's a 12-week program where the new graduate is cohorted with like people. So they get didactics together, they rotate throughout different departments, they build a bond. And that's very important when you talk about my favorite person, Abraham Maslow, when you talk about the hierarchy of needs, but belonging is one of them. So one of the things about being a new grad is belonging, onboarding, commonality, able to have a safe place to talk about maybe some unique experiences that they have had on other units. This is led by our clinical nurse specialists and our educators, and they partner with the managers of the units to make sure that the rotation is efficient and that the new graduate is actually getting what they need. They're followed up weekly and as needed. The retention rate of these new graduates is phenomenal. I just like to see them walking around 2 years later after the program, and from seeing them from the start to 2 years later is amazing.
Yeah, absolutely. And I think what Tanya was touching on, so just because it's 12 weeks of orientation, it doesn't end there, like she said. It truly is a cohort, and they actually still meet monthly as a group. All of them, they're hired at the same time. So it's just like, I just really want to stress that they stay together, because there is a lot of firsts that they're experiencing. Nursing school is fabulous, but you don't get to see the real thing all the time. And so there's a lot of first experiences that a new nurse goes through, and a lot of emotions that you have to go through with nursing as we touch, patients. So it's just nice for them to come together monthly and be able to talk with each other and share those feelings, and and just get that validation that, okay, I'm okay, this is the way, it's okay to feel this way, and that type of thing. And then of course at the end we have a nice celebration, because we want to say, yay, you're no longer going to be called a novice nurse. Now you're moving on to your confident nurse stage. So it's fun, and that's what we want nursing to be here at Mary Washington Healthcare, by all means.
Very fascinating. So that leads us to the professional practice model.
Yes. So that was a topic that we wanted everyone to know about, because we put a lot of work into changing our model. The model is our structure and our foundation, our core for nursing. And we realized that our model, we hadn't looked at it for a while, and we thought maybe it's time. We thought it changed at Mary Washington Healthcare with the addition of a new hospital, just new technologies coming around. How we care for nursing is always changing. So we took this opportunity to, and again, I think we do a really good job with this, is to reaching out to our nurses and say, hey, what does nursing look like at Mary Washington Healthcare? So we asked them to just give a one-word, adjective or whatever they want to use to describe nursing, and we gathered all this information. So it truly was the nurses empowering them to tell us what our model should look like. So we took all this information, and using our Advancing Clinical Excellence program, which is a different aspect, but we'll get into that in just a little bit, we took those members of that board and really worked on making the new model. So I know Eileen Dolman, our CNO, has talked about the model in other talks, but we really just wanted to stress that we do have a model that we work on, and it's truly our core values and what we stand for as nursing. But it was just neat to see that our nurses came to the table and said, yeah, this is what we mean, and this is what it means to us. And it really touches on the patient-centered care, which is always in the middle. And it's just neat to know that was what they came up with, and that just makes us all stronger, because that's what we're here every day and doing what we're doing. And I think we have a question, so we'll pause here and let Darla let us know the questions.
Several questions.
Okay.
So two that have come up are, how are our nurses recognized? And also, do we have an extern program?
Oh, wow. Oh, yeah. Which one would you like to answer?
So I'll talk about how our nurses are recognized. So the nurses are recognized in many ways. So we do have the DAISY program, that nurses are recognized by the patients, and which we take to the Quality Practice Council. So we do have shared governance here as well, and it's a blind vote, and there is a DAISY award selected, and that's at Stafford Hospital and Mary Washington Hospital. We also recognize nurses for the work that they do via, we have an eye care program where we can go online and we can just give them a shout out, great job, you're excellent. That can also be done peer-to-peer by the manager, by the other departments. Anyone can do that recognitions. On a lot of the units, they do thank you grants. So thank you for helping me out, thank you for coming in extra, etc. So it's multiple ways to recognize. We have a recognition program as well that we do quarterly, and you can go on our intranet and recognize nursing with that as well. So it's multiple ways of recognition. Our CNO will write a nice note to recognize someone. The leaders will write notes. You will just start getting recognized from other departments. You don't even know that people notice you. But that's one thing about the culture at Mary Washington Healthcare. And you notice I didn't say Mary Washington Hospital, because the culture here is belonging. And how do you feel belong? So when you go into the family, everyone recognizes one another. I may not know your name, but I know your face. And speaking to you on a daily basis, smiling, being polite, being nice, and that should trickle over to our patients as well, because one of the things that we're working on is our patient experience. And when we talk about patient experience, we also have to have a peer-to-peer experience that is positive.
Absolutely. The only thing I would tag on to the recognition is the Advancing Clinical Excellence program that we have, that I mentioned just briefly a minute ago, called our ACE, and that does recognize nurses at all level, because that's a neat thing that we just started about 2 years ago, is every nurse that's hired into the organization comes in at a level. So there's a 1 through 4 level, and so your 1 is the novice, and then 2 is your competent, 3 proficient, and then 4 is expert. So we are able to recognize our nurses as we want them to advance professionally. We want them to be proud of what the work they do at the bedside. So that's another way we recognize nurses at Mary Washington Healthcare, and that's in the beginning stages. We're working hard to get it up more and more involved, but everyone is coming in a level, which is a recognition, which is huge, which is nice. As far as the extern program, we did have an extern program that we've been doing pretty much every year for the last couple of years. It's usually you're going into your senior year of your nursing program, and we allow you to come in during the summer and work side by side with a nurse on on a unit. It could be any type of unit. It depends who has the availability, because we want a nursing staff to be with you. And we've had some good success. You're able to go in, work one-on-one with a nurse, see what the daily routine is. You're able to do some nursing care, of course, vital signs, help the nurse, and that type of thing. But it's more of to kind of see the life and the day of a nurse and just learn that everyday experiences and ask questions, and you really can see what the different nurses, what the daily routines are, which are nice.
We have another question.
Okay.
Felicia would like to know if we're hiring experienced per diem nurses.
Felicia, yes, we are hiring experienced per diem nurses.
Always.
That is always questions, and we're trying to get the right fit of nurse into the organization. We have opportunities to be the best healthcare organization in this part of Virginia, so we want all the experience that we can get. We have some needs throughout the organization. Don't know what your interest is, but we do.
Absolutely. So definitely reach out to the recruiters. They will help you out. But yeah, absolutely. And I think for per diem too, we also have a unique opportunity now that we have staffing pools located at both hospitals, and that's all per diem. So you come in and you tell us what you want to work on a weekly basis. There is a commitment and things like that. So absolutely, Felicia, please reach out, because we definitely have more opportunities for per diem always.
We do. Thank you, Felicia.
Great question. I think just going back, I'm not sure if we spent enough time talking about the Advancing Clinical Excellence program or not, but I just wanted to tap on that just a little bit more, and Tanya, please add what would you like. But it is definitely, I think the one thing that I really like about our program is because we really are encouraging the autonomy of the bedside nurses to, when they want to advance even further to the next level, it's all about performance improvement and identifying opportunities they see at the bedside to make a difference in patient care. And it just gives me chill bumps to kind of think of the work that some of them are doing, because they recognize a problem or an opportunity that they want to see. Why do we do it that way? What is is there a different, better way to do this? And really doing the evidence-based research and changing sometimes the way we do practice.
And Deb brings up a great point, because the projects that the nurses pick are projects that will improve their unit. So it's not a project that we give them. These projects are very robust and has a lot of rigor to them, even to the point where they want to publish their work. They share their work on their units, and just want to express that every registered nurse is part of this ACE program.
Exactly. And I think also we also have the great opportunities too with our shared governance. I think Tanya mentioned that earlier as well. But we have it at the unit levels and as the hospital level, and that's something we do expect every nurse to participate at the unit level, because that's what drives specifically what's happening on your own unit, of course. But as the hospital level, we want people and nurses at the bedside to come down and participate, and just it's neat to see the interactions, because we also have other members. We invite other members from our the ancillary staff to come through, and if there's something that we just don't see is flowing right, it's nice to see the partnership and the work that's being done to get things headed in the right course, or fix it if it's not going right, that type of thing. So it's still a lot of empowerment to the nursing staff that we definitely advocate for and encourage the staff to do.
Right. And we talked a little bit about the shared governance, and that's very important, because that's the voice of the nurse. So our councils, which we have several councils that meet, we meet monthly, and we talk about concerns that the nurse wants to talk about. And not only do we talk about it, but we develop action on what they can do to go back to their unit. And it is very rewarding to walk on a unit and see their ideal in action. And the changes that happen here in regards to nursing is because a nurse spoke up and had a better way of doing something. So it is a great thing to see to come to fruition.
Absolutely. I think, oh, Darla, do we have a question before we get into something else?
We do.
All right.
Nancy has asked, this is a large military area. Many spouses work in healthcare. Do you have a program that assists military spouses with getting positions, specifically RN positions within your facilities?
So I'll answer this.
Sure.
And the reason why I'm going to answer this is because I am a military spouse. So I'm a military spouse, and we've been with the military for 26 years. So I do get it, where you move every 2 to 3 years. And I can honestly say that Mary Washington Healthcare gave me the opportunity and advantage. I mean, I've been here twice. So the first time I came, I was in a different role, and I came back the second time, and it was just coming home to family. There is lots of opportunity for a military spouse to gain employment here. It is wonderful. It's familiar, like a military community. It's like you've known your co-workers from day one. You're not a stranger, is what I'm trying to say. If there's some education needs that you need, that's identified in the very beginning. They will provide that education for you. If it's a specialty that you're interested in, as long as you meet the requirements in regards to the experience level and the certifications, this organization works with you. It's all about being the best that you can be, and I do believe that Mary Washington Healthcare is that place.
And it just makes me smile here, and Tanya said that, because I know several nurses, even at Stafford alone, in the 9 years that we've been open, that were military, that came here because of either their husbands or whoever came here, and they followed them and started with us, and then they had to leave, unfortunately, due to orders, and they've come back. I think of one recently that went to Japan, came back, and now she went back to Japan again, and we said, okay, we'll see you when you get back again. So yeah, we definitely love our military families and fully support them just like anybody else. Absolutely.
Okay, so we have another question. What does the care team look like on a typical unit?
So on a typical unit, you have your RN skill mix, you have your certified nurse assistant skill mix, and then you will have a unit secretary that's a cross between a CNA and a unit secretary. You also work with other disciplines. So depending on what type of unit that you're on, so you may work a lot with physical therapy. It just depends on what type of unit you are. We work heavily with the ancillary staff, respiratory therapy, and basically speaking to critical care in the cardiac areas. So that's typically what it normally looks like on a day-to-day basis.
Yeah, and that's pretty similar across the board for all the areas. Labor and delivery, you have your OB tech complement with your RNs and that type of thing. But yeah, that's pretty typical across the board for us.
Right, and in the ED, of course, you have your RN, your paramedic, your EMT, you have your unit secretary there. And then you have some defined roles, and the defined roles, I mean, like if you have a charge nurse or resource nurse, etc.
Absolutely.
We do have another question, and I don't know the answer to this. Hopefully you do.
Okay.
Mary Washington has supported disaster support during local disasters. Is there an opportunity through Mary Washington Healthcare to provide support for the recent disasters of Harvey and Irma?
Wow, that's a great question. I know that register, or different nurses associations have reached out and said, you know, if you're available, please come down and that type of thing. I know as an organization that we have talked about what we could do, and I believe if there's something that we would like to do, of course, money at this point in time is always good for relief, because they're still trying to figure out what they do need at this point in time. But I don't know of anything specific, Tanya, unless you do off the top of your head.
So I've had several nurses, several paramedics, and several EMTs who have a connection to disasters and who will be going to assist with Harvey and Irma.
And I got a text from one of our vice presidents who
Okay.
is helping me out here.
I'm gonna post the link.
Okay, we are accepting donations through supporting the Texas Hospital Association.
That's what it
So
was.
we
Great.
will also post that link on our Facebook
Okay.
Live, so
Okay.
you'll be able to give as you feel led, but also to a reputable organization.
Yes,
So
that's great.
thanks for that question.
And although they're not our immediate community, they are a part of our community. And that's one of the things that we do well here. We identify what the community is.
Yes, and I know we have had a lot of our nursing staff who's you know reaching out and wanting to know what they can do. So that's always nice that we have that opportunity to provide some support and during this tough time with them.
Yeah. Okay. Well, it's been super fantastic. Personally, I could
It's
probably.
been a pleasure sitting here talking with Tanya. You
Yeah.
do well, yes. And I think we just want to leave with that. If there's questions that we didn't get to tonight specific to nursing at Mary Washington Healthcare, to please reach out. And of course, our great recruitment team will get back to you. If there's any questions about physicians or nursing in general, we're happy to answer them as well. But I also want to say thank you for joining us tonight.
Yes. Thank you.
Again, thank you so much for leading the conversation, Deborah and Tanya. Thank you to all who've tuned in to hear the exciting things that we're doing here at Mary Washington Healthcare. But tune in next month, where Elise Bernard, our Vice President and Administrator of Mary Washington Hospital, and Eileen Doman, our Vice President and Chief Nursing Officer, discuss caring for and about our associates, what we do to engage, motivate, and grow and develop our associates. That conversation will take place again on the second Tuesday, but this time October 10th at 8:30. Look forward to seeing you all there.